Alright, so yesterday we discussed an interesting remedy which is crocus sativus. Mainly, we use it in cases where there is bleeding, and the bleeding is more in a way which is defined as clots or lot of ropey, stringy blood it can be drawn into. And the state of the female will mostly be something like few minutes when they enter the consulting room. They'll be pretty much jolly, happy. They may laugh involuntarily. And after a few minutes, when you get into the case, they will become sad as if they are absorbed by the disease. In those cases, you should strongly think of crocus sativus. But there was an interesting case which I saw way back around 12 years ago in my clinical practice. And I was going through Alan's keynotes, and I found that this lady who came to me with complaints of fibroid, she was much consumed with the disease. She was very much depressed, sad. She felt that because of the fibroids in the uterus, she may not be able to, go along well in her 50s and 60s. Now she was almost in 43, 44 years of age. So she was very much worried. And there was poor appetite. Lot of fibroids, poor appetite, and lot of back pain and joint pains. And very sad and depressed person. I was, even without repertorizing, I was just going through the different remedies in the Allen's keynotes, and what I found about ustilago was an eye opener. I gave her 30 potency 3 times a day, and in a month's time, she had reduced bleeding, and in 3 months, the fibroids healed. That is the power of your observation, the symptoms that you pick up from the patient, and what you prescribe. So ustilago, if we read from Allen's keynotes, it is as large as around 5 to 7 or 8 pages, I believe. But we need not go through all the details. You have the book at your disposal. I'm just here to give broad highlights about it and what would be your prescriptive pointers. One of the areas is that there is a sadness in the lady with irritability. All across in the Allen's keynotes, Dr. Allen has mentioned for ustilago that there is depression of spirits, sadness, mental weakness, and great irritability. And there would be restless sleep or someone who is disturbed because the sleep is not good. Next, you have lot of symptoms from the head, from the eyes, from the nose, face, throat, mouth. But what is important is that in the head, if you see that there is vertigo, especially in women who are in the climacteric age, there is headache in those women, and the headache is as if congestive bursting type of pain. And going further, when we go to appetite, we see that there is poor appetite and also followed by canine hunger. So it is an alternating state, just like we saw in the crocus sativus. In the female reproductive system, there are a lot of symptoms for the male, gastrointestinal, female, urinary, etc. But I will touch the female reproductive system, which is the main sphere of action for our practice. And you see that there is menses, which is too scanty, with ovarian irritation. The uterus is hypertrophied, cervix is spongy and sensitive, and there is a concomitant symptom that you will come across, and that is a constant pain in the left breast in the margin of the ribs when the periods are not there. That is the concomitant symptom that you will get. And then you have flabby or relaxed condition of the pelvic organs and a state of relaxation or atony of the uterus. You will see those in the reports as well. There will be prolapse also. And there will be flushes of heat, which you similarly see in sulfur, natramure, graphitis. But here there is these concomitant symptoms which I enumerated just a few minutes ago, which will guide you to the prescription of ustilago. The bleeding for the lady who is having this fibroid conditions or hypertrophied uterus will happen on the slightest provocation, which means least overexertion, least mental stress will cause the bleed from the uterus to occur, and the patient will report to you that every 8 to 10 days there is a bleeding, almost like thalassemia bursa pastoris, which has the symptom one period finishes but the other begins as soon as the first gets over. And you have an acute pain in the left mammary as well as in the left inguinal region, which is shooting down to the legs for ustilago maydis. Next you have is that the patient may not be even able to walk due to the pain in the left ovary to the left leg. The entire left leg is affected and the patient may even limp. And there will be profuse menstrual cycle or flow, which will last from 10 days to 2 weeks. And there are gushes of red bright blood and lot of clots also, which disturbs the patient. The symptoms of backache will also be there, but it is more prominently seen in sabina. For ustilago, you also have another important symptom, and that is someone who is having lot of distension of the stomach. They will be having bloatedness constantly and they are inclined to be fat, and someone who is having severe menstrual cramps, unable to control, with pain in the ovaries. I described the left mammary, the left ovary, the left inguinal region, and a poor appetite. So in Allen, for ustilago, there is around 4 to 5 pages of female reproductive system that they have mentioned. But what is interesting is that everywhere the same thing is repeated, which is the essence of the remedy. There will be headache, there will be vertigo, there will be poor appetite, there will be dysmenorrhea, there will be bleeding from slightest provocation, and there will be hypertrophied uterus with lot of clots from the uterus passing. That is going to be your prescription for ustilago. And then you have the back complaints. For the back, there is pain in the back extending to the extreme end of the spine, which is the coccyx, can be sacrum also. Rheumatic pains in the lumbar region, pain in the back of the neck. So if you see lot of female reproductive remedies, the remedies which act on the female reproductive system will have the connection with the joint complaints. I have prescribed thalassemia bursa pastoris in rheumatic complaints of females who have had lot of menstrual flow, and both the complaints improved. The rheumatic pains as well, the joint pains also. But in thalassemia bursa pastoris, it is more of the smaller joints because it is a uric acid diathesis remedy. And ustilago, the pains are mostly in the back of the spine. That will be your guide for prescribing ustilago. And there will be incontinence or frequency of urging of urination, which is going to be very much troublesome for the patient because of the hypertrophied uterus. Also, there would be tendency to small boils. The boils will mostly be small in nature, just like you see the pimples. Exactly similar boils you will see in the female patient. Presence of them in the climacteric age should arouse a suspicion for the hormonal disturbance, and you should be able to prescribe ustilago. And there will be neuralgic pains in the forehead, hands and feet for ustilago. And most importantly, there will be pain in the spine, which is very much important with the clots that flow in the female menstrual blood. That should point to ustilago. You can compare this remedy on lot of fronts. From the scalp affections, it can be compared to Medorinum, Miserium, Sorinum, Vinca minora, or in vicarious menstruation you can compare with Hemamelis, Millefolium, Phosphorus. And in bearing down complaints or prolapse of complaints, you can compare with Lilium tigrinum, Murex and Sepia. And lot of pains in the left side of the breast, ustilago will have between the menses or left ovarian region during the menses. Similar presence is also seen in lichen, in sanguinaria, and you will have Sickle cord, which is also very closely related to ustilago for menstrual troubles at climacteric. So it's a small remedy. Once we understand where to prescribe, how to prescribe, patient would be sad, mentally depressed, lot of fibroids in the uterus, hypertrophied uterus, clots which flow from the uterus during every menstrual flow, pains which are extending to the spine, from the abdomen, from the breast, and more importantly, poor appetite and urging to urine, which is frequently. This should be the gist of prescribing ustilago in clinical practice. You can find some more which are good for your benefit or your pointers, but these are my pointers which I have used in my clinical practice. So that's all from today's short and concise session, and we'll meet again tomorrow with another remedy from the female reproductive system from the Allen's keynotes. There are a handful of remedies left, I believe only 30 or less than 50 remedies. And if you are getting the benefit of this Allen's keynote study streak, do mention in the comments of the video so that I know someone is watching out there and getting inspired to continue this streak of studying Allen's keynotes on a daily basis. The only thing which a homeopath should do every day should be to read Materia Medica as much as he can, at least in a streak, at least in a way where he can compare the remedies in a group, so that when a patient comes to you, you should be able to understand when to prescribe aconite, when not to prescribe belladonna, when to prescribe gelsemium, when not to prescribe belladonna, when not to prescribe aconite, or vice versa, when to prescribe belladonna and when to not prescribe aconite and gelsemium. This is just one example, but in your clinical practice, everywhere you will get stuck up with these situations, and you need to know how to differentiate, and the only way to differentiate is to study the remedies by comparison. So that's all from today's session, and see you all tomorrow again 5:15 p.m.